Breast cancer. What is breast cancer? Breast cancer is a malignant tumor that has developed from cells in the breast. Breast cancer can begin in the cells of the lobulus ducts or less commonly the stromal tissues. Breast cancer is caused by a genetic abnormality. Breast cancer is a disease in which malignant cancer cells form in the tissues of the breast. A family history of breast cancer and other factors increase the risk of breast cancer. Breast cancer is sometimes caused by inherited gene mutations. The use of certain medicines and other factors decrease the risk of breast cancer. Signs of breast cancer include a lump or change in the breast. Key statistics. About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. For women in the U.S., breast cancer death rates are higher than those of other cancers besides lung cancer. Only 5 to 10% of cancers are due to an abnormality inherited from your mother or father. 85 to 90% of breast cancers are due to genetic abnormalities that happen as a result of the body's gene process. Women in the U.S. breast cancer death rates are higher than those of other cancers, besides lung cancer. About 2,620 new cases of invasive breast cancer are expected to be diagnosed in men in 2020. A man's lifetime risk of breast cancer is about 1 in 883. Risk factors. Weight. Having more fat tissue means having higher estrogen levels, which can increase cancer risk. Diet. Maintaining a moderately healthy diet may decrease your chances of breast cancer. Exercise. The evidence is growing that exercise can reduce breast cancer risk. Alcohol consumption. Alcohol can limit your liver's ability to control blood levels of the hormone estrogen, which in turn can increase risk. Drug use. Drugs can affect the normal functions of the body that fight disease or illness. Gender. Being a woman is the most significant risk factor for developing breast cancer. Age. From age 30 to 39, the risk is 1 in 228 or 0.44%. That jumps to 1 in 29 or just under 3.5% by the time you are in your 60s. Pregnancy and breastfeeding. Women who have had a full-term pregnancy or had their first full-term pregnancy after age 30 have an increased risk of breast cancer. Exposure to estrogen. The female hormone estrogen stimulates breast cell growth. Race. White women are slightly more likely to develop breast cancer than Black women. What causes breast cancer? While there is no exact cause of breast cancer, there are many different factors that have been linked to the cancer. Menstrual cycle, dense breast tissue, a family history of breast cancer, menopause, and damaged cells. Prevention and detection. There is no way to prevent breast cancer, but there are things you can do to lower your risk, such as keeping a healthy weight, exercising regularly, limiting alcohol intake, breastfeeding your children if possible. Yearly scheduled breast cancer screening tests can detect cancer before there are any signs or symptoms. A mammogram is an X-ray of the breast. For many women, mammograms are the best way to find breast cancer early, when it is easier to treat and before it is big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. Signs of breast cancer: new lump in the breast or underarms, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area of the breast, pulling in the nipple or the pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size or shape of the breast, pain in any area of the breast. How is breast cancer diagnosed? Breast ultrasound, a machine that uses sound waves to make detailed pictures called sonograms of areas inside the breast. Diagnostic mammogram, if you have a problem in your breast, such as lumps, or if an area of the breast looks abnormal on a screening mammogram, doctors may have you get a diagnostic mammogram. There is more detailed x-ray of the breast. Magnetic resonance imaging, or an MRI, a kind of body scan that uses a magnet linked to a computer. The MRI scan will make detailed pictures of areas inside the breast. Biopsy. This is a test that removes tissue or fluid from the breast to be looked at under a microscope and do more testing. There are different kinds of biopsies, for example, fine needle aspiration, core biopsy, or open biopsy. Staging of breast cancer. Staging is the process of finding out how much cancer is in a person's body and where it's located. It's how the doctor determines the stage of a person's cancer. Stage 0. This is a precancerous stage with no invasive cancer cells. Stage 1. The tumor is small and localized to the breast. The American Society of Clinical Oncology reports that 62% of women are diagnosed at stage 1. Stage 2. The tumor is either greater than 2 centimeters. It has spread to the lymph nodes under the arm. Stage 3. This stage includes cancers that have spread to the skin, chest wall, or multiple lymph nodes in or near the breast. Stage 4. This is a metastatic breast cancer, meaning it's spread to one or more distant parts of the body, most commonly to the bones, lungs, or liver. The survival rates of breast cancer. There's about a 5-year survival rate for U.S. women. Precancerous is 100%, localized 99%, regional is 86%, and distant is 27%. For men, precancerous is 100%, localized is 96%, regional is 83%, and distant is 22% survival rate. Treatment of breast cancer. Surgery, breast-conserving surgery, mastectomy, a lymph node dissection, and what to expect from each also included prophylactic surgery and breast reconstruction. Chemotherapy, how chemotherapy works, who should get it, different types and combinations and side effects, and how to manage them. Radiation therapy, how radiation therapy works, who it's for, advantages, side effects, and what to expect when you get it. Hormonal therapy, the link between hormones and breast cancer and how different groups of drugs, including ERDs and SCRMs and aromatase inhibitors, can affect that link, also covered. Side effects of hormonal therapies. Targeted therapy, how different drugs work, who should get them, how they're given, side effects, and major studies. Immunotherapy, what is immunotherapy, different types of immunotherapy, and who it's for. Thank you.